I am finally back with the YouTube videos, so put on a fresh pot of coffee, get comfortable, and join me here because we have a lot to talk about. If you follow me on Instagram, you may have seen that I recently posted the C-section rates around the Baton Rouge area, so Houma Thibodaux, Baton Rouge, North Shore, New Orleans, Lafayette, just to kind of give you guys an idea of what the hospitals look like as far as C-sections. And many of you guys were really surprised to learn about the C-section rates in Louisiana. So Louisiana has consistently held the highest or second highest cesarean rate. In 2017, we came in second place with 37.5% cesarean rate. Mississippi was number one at 37.8%. And this is compared to Utah, which had the lowest at 22%. So 37.5 is really high. And a lot of people were really surprised by their personal hospital's rate. So talking about the highest C-section rate in and around this area would be East Jeff at 39%-ish, and then the lowest is Turow at 21%. Which is awesome because that means that Turow is below even the lowest average because Utah was 22%. So that's really good. Something that might be a little eye-opening for you guys too is that when I was looking up the rates for C-sections, I decided to just check in on like Denver hospitals and see what their rates are. And one of the lowest cesarean rates in Denver is 8% at one hospital. So really freaking low, and we are really freaking high. So I kind of want to talk about why Louisiana is so high. What is it about this area? These are my personal thoughts on the topic, so feel free to disagree, whatever. One of the main things is a lack of education. So down here, there's just a lack of education. There's a lack of knowledge on alternative care practices. There's a lack of openness to alternative care as well. And so if we don't talk about it, then nothing's going to change. If we don't advocate for a different birthing experience, then nothing's going to change. Instead, we're just going to see the same numbers over and over again, if not higher, because the more that we opt for medical interventions, the higher the possibility of a C-section rate goes. Also, we're not the healthiest state. So if we are really unhealthy, it's going to be more difficult for us to birth in a more unmedicated way because our bodies are not healthy. They're not primed for this type of experience. So these are just my thoughts on this kind of thing. I could be wrong, of course. This is just what I've been seeing. Going back to the lack of education, though, we also have a lot more intervention here. So we started doing this whole thing where when you hit 40 weeks, they induce you. You can even get induced as early as 39 weeks because the baby's too big. So why are we doing that? Why aren't we telling women, look, 40 weeks is about when you're due, but if you're a first-time mom, the average is about 41 and 5 days. It's almost 42 weeks of pregnancy. So by telling women that, yeah, by 40 weeks you'll get the baby out, that already messes up their mind because when 40 weeks come, they're like, get this kid out of me. Whereas if we tell them ahead of time, like, look, you're looking at closer to 42, that'll kind of help them a little bit better as far as like, not being so antsy to just get the kid out. I think if you're healthier and if you exercise, then you have less instance of lots of pain during pregnancy. So that could also make your last weeks really uncomfortable and make you more inclined to choose intervention if you're not comfortable. So exercise and eating well is also really important. If you want to avoid a C-section, then do not be induced unless it's medically necessary. More often than not, the inductions are not medically necessary. The baby being too big is the newest reasoning for induction, and there is really no scientific research to back this up at all. Just because your baby is too big does not mean that the baby cannot come out of the birth canal. And if by some crazy low percentage chance that is the case, then that is when cesarean sections are used. For the very few times that it's truly emergent. Other than that, we shouldn't be forcing women to have C-sections. As long as the baby's okay and the mother's okay, we can kind of take our time here. But the more that we intervene and we use these medications and we try to force the baby or the body into labor and delivery before it's ready, the higher the chances are for C-section, because we're not working with the body, we're working against it. We're pushing it to do something it's not primed to do yet. So don't be induced. That's the first thing. Wrap your brain around being pregnant for closer to 42 weeks. Build a really healthy body to withstand the changes of pregnancy. Go to pelvic floor PT, exercise, eat well, that kind of thing. And don't be induced. Wrap your head around being pregnant for a while, okay? Second thing is you want to make sure that you are educating yourself. And this one honestly should be number one. You have to educate yourself. Your doctor is awesome at keeping you and the baby alive, but they're humans just like we are, and they can't possibly know everything. So you really have to educate yourself, and you have to advocate for yourself. You have to advocate for a birthing experience that feels good for you, and be open to learning about different ways of having your baby. So education is first and foremost. One of the really good ways that you can get good education on birth is by choosing independent birthing classes. So if you choose a birthing class outside of the hospital setting, but with an independent childbirth educator, you're going to get more education, you're going to get more good information, and you're going to get meat to it. You'll also be meeting, most childbirth education classes are kind of like weekly for however many hours or weeks. So you'll get a closer or smaller group, and you'll be able to ask more questions and kind of just get some better advice for you specifically through a childbirth educator. So that's a really good option too, to kind of encourage that education. I hear a lot of crazy things about birth, about just so many things, and it's all wrapped up in a lack of education. People just don't know. So start doing some research and read things on all the interventions. There's pros and cons to every intervention and every non-intervention. So just kind of get comfortable with weighing your options. The second thing that you can do is choose a doula. So in a study by Cochrane in 2017, the results of having a doula showed a decrease in C-section rates by 25%. So if you are adamant about not having a C-section, or if you are in an area of town where C-sections are really common and you're kind of worried about that, hire a doula, because they will be able to help you keep things going, change positions if something happens, or if the baby's in a funky position. They'll be able to give you really good information. They're going to tell you what questions to ask the doctor. They're going to encourage you to try different things, use different types of more natural types of interventions, so birthing balls and rebozos and position changes and stuff like that. I hear a lot of people say that when they go into labor, they get to the hospital, they get into their room, and they get in the bed, and they stay in the bed, even if they hadn't gotten the epidural yet. And so one of the things that people don't realize is that if you don't move during labor, then things aren't going to get going. You have to move the body. Movement during labor is so important. And so a doula can be there to help you move in good positions. And then if you do have the epidural, how to put you in different positions in the bed. So maybe you are bed bound, but it doesn't mean that you're stuck in one position. The other thing that you can do is avoid getting an epidural until you're closer to 6 centimeters. So if you go in and they tell you, okay, you're only at 3 centimeters dilated, be prepared to work a little bit to get to 6 before you get that epidural. If you get the epidural too early, it could slow things down for you. So we want to make sure that we've got some good momentum going and we get the epidural when it's needed and not beforehand. Usually at 3 centimeters, your contractions are not really considered active labor contractions. You should be able to kind of breathe through them with ease. So definitely consider working a little bit before you get that epidural, because again, it's just going to increase the chances of things continuing to move forward as opposed to just slowing down. And then the last recommendation is also from the newest ACOG guidelines, which states that you should be laboring at home for as long as possible. So this is going to be different depending on if you're high risk or not, and then if you test positive for group B strep. If your water breaks and you're not in labor, but you are positive for group B strep, they're going to tell you to go in. Okay, so, and you can do your own research on that and decide. And that's fine, whatever. You can go in and still get things going for yourself by staying upright, by changing positions. If you are not group B positive and you are laboring at home, you want to do so until your contractions are closer to 411. So this means that they are every 4 minutes, lasting for a minute to 2 minutes, and they've been patterned this way for at least an hour, okay? So that is vital to ensure that things keep moving in a good direction for you. Because if you go in the second you feel a contraction, through the process of getting assessed and then put into a room, because there's other things going on and your mind is distracted, you're kind of taken out of your birth experience, typically women's contractions do slow down a bit there. But if you wait to go in whenever you're at a good number, they'll stay more regular instead of like slowing down or stopping altogether. If you're laboring at home, you can also eat and drink, which is super, super important because so many women will tire out because they're not getting any energy because a lot of doctors are still adhering to the no food or drink during labor and delivery, even though the new guidelines state that women should be able to eat and drink freely. So keep that in mind that if your hospital's policy is for you not to eat or drink, then you want to stay home as long as possible to make sure that you are fueling your body for this marathon, because birth is not something that usually happens really quickly. You're looking at, anywhere from 8 to 12, sometimes 24, 36 hours. So you don't want to go that long without eating anything if you can help it. So those are some tips to decrease your chances of labor and delivery, decrease your chances of C-section during labor and delivery. Also choosing a provider that is less C-section happy. So provider C-section rates are public information. So you can call the hospital, ask to speak with somebody in records, and then see what your doctor's rates are, or just ask your doctor personally, hey, what are your C-section rates? How do you view C-section? If you hear certain doctors that are all their patients are saying C-section, 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 then that's probably not the doctor for you. Also choosing a hospital with a lower C-section rate might be a better option as well, just to kind of increase your chances of being able to birth vaginally. And then just keep kind of having these conversations, keep talking, keep educating, keep encouraging people to kind of look past the okay, gotta go to C-section, and ask questions. I've had so many people tell me that they had a C-section, and when I ask why, if they come in and we're doing an assessment, I need to know what the C-section was for, if there was a medical issue and things like that. So whenever I'm learning about my patients and I ask why, I've had quite a few tell me they don't know. They don't know why they got a C-section. And that's just unacceptable. So this is your body. You need to advocate for yourself. You need to ask questions and take your time. It's very rare that things are truly emergent in birth. It's less than 3% of the time. So more often than not, you have time to make alternative decisions. So just keep advocating, keep asking questions, keep educating, and you should be good to go. Thank you so much for watching this video. Please leave any questions or comments below and be sure to subscribe for more like this.